I really like practicing in a Christian setting where we're able to bring Jesus and His Word into our counseling sessions. So I wanted an environment in which I was able to do that. My primary areas of specialty are developmental disorders like Autism Spectrum Disorder and an ADHD diagnosis. So I like practicing and treating those kinds of things. I also do foster care and adoption. So I started doing that more in the middle of my practice, but I really like that, and I have been trained and am now an adoption competent mental health practitioner in that area. Christian counseling is very important because we are able to bring in that gospel truth, providing hope to lots and lots of families where they didn't have that hope before. I approach counseling from a family systems perspective, which means that most of the time I'll have parents in the same room as their children, learning along with their children, using the same vocabulary I use. So I do a fair amount of modeling to teach parents how to take the techniques we're using in counseling and put them into the home. I also play on the floor a lot with some of the little kids that I will do therapy with. So I have a dollhouse in my office, and that oftentimes can prove to be a really successful tool to make play mold into what your life experience is like. I use a cognitive behavioral therapy approach as well. So I do a lot of worksheets, or will draw on the big old whiteboard that I have in my office. I would tell that person that's reluctant to come to counseling that most everybody is reluctant to come to counseling because it is kind of a scary thing to tell everybody or tell someone you don't know what you're struggling with. But oftentimes during that first session, I will be able to reassure you that you're going to be just fine, we'll get through this, and develop a treatment plan right there so that the patient leaves with knowledge of what they're going to be doing instead of unknown.